Most men masturbate, but very few know that doing it wrong can end up affecting their body, their mind, or even their sex life. Some of the mistakes can cause serious physical injuries when practiced. Many others, much more frequent, will only be noticed when the person is with someone and sees that something isn't quite right. And the most striking thing is that one of the most dangerous practices is also one of the most normal. I'm Dr. Melani Rubio, a urologist with over 10 years of experience specializing in male sexual health. And today I'm going to explain something that most men have never been taught properly: how masturbation, when done incorrectly or compulsively, can fundamentally alter your sexual response, damage your physical structures, and create patterns that make real intimacy with another person surprisingly difficult or even impossible. This isn't about shame. This isn't about telling you that masturbation is wrong or dangerous in itself. Masturbation is a normal, natural part of human sexuality. But like anything else in life, how you do it, why you do it, and the patterns you create around it matter enormously. And most men have never had an honest, scientifically grounded conversation about what those patterns might be doing to them. To understand this topic better, you first have to understand how arousal, erection, and ejaculation actually work. Many structures are involved, such as the peripheral nervous system, the structure of the penis itself, the pelvic floor muscles, the vascular system with arteries and veins, and of course, the most important thing, which is our mind. First, arousal begins with a stimulus, whether it's a tactile stimulus, for example, someone touching your genitals, or a visual stimulus, like seeing the person you like without clothes in an intimate situation, in the same way as perhaps watching an adult video. But we're going to see that later. And of course, our mind plays an extremely important role, whether with fantasies, memories, or even to enhance situations we're experiencing in the moment. Remember what I'm telling you about stimuli, because we're going to see this much more at the end of the video, and it's fundamental for you to understand it. When we have these stimuli, a response is triggered at the nerve level that causes an increase in blood flow entering through the arteries to the penis, and a decrease in outflow through the veins of the penis. What this will cause is that a greater amount of blood remains in the penis, which causes an erection. You surely know that an erection is an increase in the length, thickness, and hardness of the penis. And this phenomenon is dynamic due to the entry and exit of blood. We don't have a bone inside the penis. As arousal continues, it will end up causing ejaculation. For ejaculation to occur, there must be perfect coordination between the nerve structures, between the substances that will be produced for ejaculation, and of course, the pelvic floor muscles. And the final result will be ejaculation. What I want you to see from this explanation is that not everything depends on the physical, not everything depends on touch, friction, and so on. But we have something very important, which is our nervous system, both through the structures it has and through what we call the mind. And it's what basically commands us. It's the most important sexual organ. Within our mind, we're going to receive a lot of stimuli from the outside, and that's where erogenous zones appear. In general, men have our main erogenous zone, and what we always focus on is the penis. But this will vary from person to person. Within the penis, generally the glans is the area with the greatest sensitivity, but we also have the entire scrotum area, which contains the testicles, as well as the perineum, which is the skin between the testicles and the anus, and of course the anal area. And on some occasions, there are those who say that the P-spot exists, where the prostate can be touched from the anus, and there's much more pleasure due to nerve endings, but it doesn't end there. Each person is unique. Even different areas of the skin, for example thighs or even nipples or the neck, can be areas that generate arousal for the person experiencing them. Let's also remember the other senses, both sight, as I mentioned at the beginning, as well as hearing or taste or smell. All information coming from the senses can cause arousal depending on what that person considers arousing. Each person has their particular erogenous zones, as well as different ways of getting aroused that are very individual to each one. Understanding this is fundamental to avoid having behaviors that can become counterproductive when repeated over time, mainly when they are behaviors that one has seen in a video and tries to apply them forcibly. Does that sound familiar? Not only are they bad habits, but certain masturbatory practices could cause damage to different structures of everything I was telling you about just now: skin injuries, damage to the structure of the penis, as well as slightly more serious things like internal injuries or something we'll see later. And part of this damage could be related to the sociocultural context where these behaviors appear or are repeated over time. To talk about masturbation, we must also talk about the sociocultural environment, because although it's a fairly common and natural practice, it's loaded with shame, taboos, and, above all, guilt. Many men grew up hearing that this was something dirty that could cause them harm or even affect their health, and those messages, although they seem old-fashioned, can leave their mark on a person. Sometimes that guilt is sustained in religious discourse that presents it as a sin, something morally incorrect or shameful, and that view continues to weigh even for those who are no longer believers. And with this, I'm not forcing anyone to do any type of practice that is improper or that doesn't adapt to the values they practice. But my idea with this video is that you can have information so that you don't have any risk and can enjoy your life. If a person for religious or moral reasons doesn't wish to masturbate, that's completely respectable. In the same way, it's respectable that a person who wants to do it in privacy and safely also does so without any type of shame or guilt. Guilt, which is silent and persistent, can lead to masturbation being practiced in secret and always in a rush, without being able to talk about it with anyone, nor fully understanding it. Much worse is that masturbation is done hastily, with that constant worry of being discovered or doing an impure act. This can bring several complications in the future, such as premature ejaculation or difficulties connecting with a person authentically, as I'm going to explain a little later in this video. And something that many people know but don't take into account is that orgasm functions as a natural anxiolytic. Masturbation in many cases becomes a quick way to calm anxiety, lower stress, or simply to disconnect for a while. And even more so in a society like the one we currently have, where anxiety, stress, and a fast pace are common currency every day. That's why, when masturbation is done more out of necessity than desire, more out of anguish than pleasure, that's when we're entering really problematic territory. Tell me in the comments if you think current society masturbates much more to lower anxiety than because they really have pleasure. What do you think? Leave it in the comments and I'll read it later. In extreme cases, masturbation interferes with social life, with routines, and even with respect for others. Cases like exhibitionism or masturbation addiction, as well as certain behaviors that cross the limit of what is considered socially acceptable, have serious consequences and even legal consequences. And of course, that's not just what we're going to talk about in the video. Many of these bad masturbatory practices are what can cause physical injuries that can sometimes be very serious. Let's review what structures are involved and the real risks that can exist. Let's start with something very common: paraphimosis. This happens when the foreskin skin, which is the elastic skin that wraps around the head of the penis in uncircumcised men, forms a fibrotic ring, an area of much denser and less elastic skin than the rest of the skin. The problem with this fibrotic ring is that when the foreskin is pulled back, sometimes that ring can get stuck behind the glands, which means it can't be pulled back up. You can imagine that this ring of fibrous skin can end up causing the glands not to have enough circulation, even causing ischemia and potentially being lost. And of course, that's something very serious. When this occurs, if it can't be resolved spontaneously at home, you have to go to an emergency service. There are also reported ulcers on the penis that are caused by friction, either with sheets or with some other type of element. And although this may seem quite obvious, sometimes this type of injury can be confused with sexually transmitted infections, for example with herpes or syphilis. This type of injury is quite frequent, and generally one can end up with the diagnosis with a good interrogation, although sometimes it presents difficulties in being able to address this topic. Hey, stay, because this is just getting started. Something much more serious but much less frequent is penile fracture. But before I explain it to you, give me a second while I have a coffee while you leave me a comment and tell me if you had heard about this. Although the penis has no bone, it does have structures called corpora cavernosa that, with very abrupt friction, as can happen during sex or masturbation, can rupture. And if this is not treated urgently with surgery, it can cause severe, lifelong erectile dysfunction. In those cases, a crack occurs. The pain is imminent and appears at the moment, and there may also be a hematoma. The penis swells and turns purple or reddish. It's important to raise awareness because if we arrive late, we can't apply adequate treatment, and the only solution in those cases is a penile prosthesis. There are also situations where rings or constricting elements are placed, such as bottle caps, hoops, nuts, or even zip ties, either to maintain the erection, to try to seek pleasure, or simply because they were curious. Just as I explained with paraphimosis, when a person places, for example, a ring or a bottle cap on the penis can grow, and the structure ends up constricting the penis, which causes a decrease in blood flow, and if it's not removed in time, we have serious damage with ischemia, infarction, necrosis, even loss of the member, and much worse things. And there's still much more. Occasionally, people, out of curiosity or to seek pleasure, insert objects into different natural cavities, which can cause damage. The most common are objects in the rectum. Remember that the rectum has no bottom and communicates with the entire colon, that is, with the entire large intestine. So by inserting objects that are not designed for this purpose, such as fruits, deodorants, bottles, balls, among other things, these can cross the limit of what is the anus, reach the rectum, and remain inside, not come out. And something much worse is that some of these objects can cause very serious damage when they are not designed for this. And I'm not just talking about the damage it can cause at the mucosa level or at the sphincter level. It's worth highlighting this report I found in which a person inserted a device that blew air at high pressure and caused a rectal rupture. Of course, the consequence was fatal. Another very risky practice is the introduction of objects into the urethra. And I'm not just referring to USB cables, TV antennas, or even pens, but also to something that they make us believe can be viable, but it's not. And I'm talking about devices that are sold on the internet as safe or suitable for this use. The so-called sounding is a completely discouraged practice. The urethra is a very delicate structure, and its mucosa can be damaged very easily. And by this I mean that no matter how much someone on the internet sells these devices as safe, it should not be done under any circumstances. Much worse is that some of these objects can migrate into the bladder, and even, as I found in the report you'll see down here, some objects can pass into the retroperitoneum, that is the space behind the abdominal cavity where the kidneys are located. Continuing with very dangerous behaviors, we must name autoerotic asphyxiation. This consists of reducing oxygen flow through asphyxiation, which they say intensifies orgasm. Of course, this is a completely discouraged practice. The risk is quite obvious, and you can imagine what the outcomes can be. Really, when you start researching in databases, we see hundreds of reports of dangerous masturbatory practices of the most diverse kind, from intoxication with nitrous oxide or laughing gas to even thoracic crushing from using a jetpack from a flight simulator, as well as some diseases that can manifest when masturbating, such as aortic dissection or heart attack, among other issues. In this last case, it's not that it's a dangerous practice, but they were really patients with cardiovascular history who, when masturbating, remember this causes a whole change at the hemodynamic level. And, well, it just caused a complication. I still have to tell you what, for me, is the most common and most dangerous practice of all. And the worst thing is that most people don't see it coming. The list of reports is huge. In fact, you can pause the video and you'll see here all the bibliography I researched to be able to make this part of the video. And I don't want to do this to scare you or try to do something sensationalist, but simply so you know it exists and people become aware of what can be risky for their health. And that's where I want to go. Many of these practices, as I was telling you, that can be risky for health are really frequent, because the most common is what often does the most damage, and many of those behaviors may seem harmless. But the moment of sharing intimacy with another person is when the problems come to light. Until now, we've talked about physical injuries, as well as social problems that these bad practices can have. But there's something else, and that's the effects these bad practices can have when having intimacy with another person. Remember when at the beginning we said that arousal adapts and that there are numerous types of stimuli? Therefore, if we always train in the same way, with a certain pressure in the hand, with a rhythm in some particular posture, or something much worse, which is only with visual stimuli, as occurs with pornography, our mind becomes specifically accustomed to getting aroused with that type of stimulus. Replicating that with another person becomes quite difficult. For example, some men lose sensitivity during penetration, or even find it very difficult or cannot ejaculate. So you can imagine what happens when a man is very trained to practice it alone in a hurry and in a very vigorous way. Precisely later, it's very difficult for him to adapt to a real encounter with another person. And that could also be associated with something we talked about at the beginning and has to do with the ways in which one learns to stimulate themselves from youth in a hurry, with fear of being discovered, probably in a very rushed or very vigorous way, and above all, watching pornography. And the problem is not just with the hand. Both men and women sometimes get used to using some specific type of toy, often vibrators or that have some particular movement, and of course, then they find it difficult to have stimulation or arousal when they're with a person. And the problem is not the toy itself, but it's in the disconnection between the stimulus and the emotional experience, as well as the frequency with which that toy is used or a person masturbates alone, and of course the way in which they use it. It's then when that person has an intimate encounter with another person, when performance anxiety appears, frustration, guilt, and often emptiness. A quite frequent situation when we do an interrogation in the consultation, because when masturbation is very loaded with isolation, anguish, or anxiety, that way of relating to oneself ends up interfering when one tries to relate to another person. And if you're wondering why there are so many disconnected or frustrated men, a large part of the answer is in what they consume. Take advantage and also drink a glass of water before we continue and leave a like, and it's in the answer to this question where everything mixes. Unrealistic expectations, overstimulation, and an idea of sex that has little to do with reality. Pornography itself is not the enemy. The problem is how it's consumed, how it's repeated, how it becomes a habit, a refuge, and even the only way of arousal. Because when our mind only connects with edited images, bodies that are completely perfect and worked on, and stimuli that are increasingly intense, it will often be difficult for us to connect with reality, with skin, with a nice conversation, with a romantic scene, with a slow pace of relating. That is, with a real bond. And that's why pornography brings several problems. Difficulty getting aroused, erectile dysfunction, premature ejaculation, relationships that don't work, and a lot of frustration, and no one can understand where all that comes from. This is a topic that not all people dare to talk about and that many don't even know about. That's why I think it's fundamental to make the pornography problem visible. And with this, I want to tell you that if this video reaches 2,000 likes, I'm going to make a specific video dedicated to the problems brought by consuming pornographic videos. We're going to use concrete data, and above all, I'm going to try to explain it to you in a practical way. But we have to reach 2,000 likes, and surely this video will appear here. And if it appeared because time has passed and you watched it and liked it, surely you can watch the other one that will appear here or here. Not only will you learn, but you'll be helping me a lot to be able to generate this type of content. Thank you.